Hey there, let's be honest. Have you ever looked at an arterial blood gas problem and just felt completely lost? Well, you are in the right place. Today, we're going to crash the code on this super complex topic using a surprisingly simple method you already know and love, tic-tac-toe. Let's jump right in.
And trust me, you are not alone. Trying to interpret ABGs is a rite of passage for pretty much everyone in the medical field. It can feel like you're trying to learn a whole new language. But the good news? There's a secret handshake, a simple tool that makes it all make sense.
So here's our game plan. First, we'll look at why ABGs are so tricky. Then I'll introduce you to your new secret weapon. We'll learn the rules of the game, play around together, and then figure out how to read the final score. In just 5 steps, you're gonna go from confused to confident.
So what's the big deal with ABGs anyway? Well, it's all about figuring out your patient's acid-base balance from a set of numbers. Are they acidotic or alkalotic? Is the problem coming from their lungs? That's respiratory. Or is it a metabolic issue? Getting this right is absolutely critical for patient care. And that's where this awesome little trick comes into play. The tic-tac-toe method is a game changer. It takes all those numbers and confusing rules and lays them out on a simple visual grid. It literally turns this diagnostic puzzle into a game you can actually win. Now, we're totally hijacking the classic tic-tac-toe board, but we're ditching the X's and O's. The new goal is to take our patient's lab values, their pH, CO2, and bicarb, and place them on the board to see which column gives us a winning lineup. 3 in a row wins. Okay, so any good game has rules, right? And for ABGs, the rules are just the normal lab values. I'm telling you, memorizing these values is the most important thing you can do. It's the foundation for everything else. All right, let's look at the rules of our game. We've got 3 main players on the board: pH, PCO₂, and HCO₃. For pH, normal is between 7.35 and 7.45. Anything lower is acid, anything higher is base or alkalotic. For HCO₃, our metabolic player, the rule is pretty similar. Below 22 is acid, above 26 is base. Easy enough. But then there's PCO₂. Okay, lean in for this one, because this is the one weird rule that trips everybody up. PaCO₂, our respiratory value, works completely opposite from the others. A high PaCO₂ is acidic, and a low PaCO₂ is basic. Just burn this into your brain. Respiratory is opposite. If you remember that, you're golden. All right, enough theory. We know the rules, we've got our game board ready. It's time to actually play. Let's walk through a real example together, step by step, so you can see just how slick this method is. Here we go. Here are our patient's stats: a pH of 7.23, a PaCO₂ of 50, and an HCO₃ of 30. We have everything we need to solve this puzzle. And here's our blank canvas, a clean tic-tac-toe board with 3 columns: acid, normal, and base. Our job is just to figure out where each of those 3 values belongs. Okay, first move. The patient's pH is 7.23. Now think back to our normal range of 7.35 to 7.45. Where does this first piece go on the board? Yep, you got it. Since 7.23 is lower than 7.35, it falls right into the acid column. So we'll put our pH right there. See? 1 down, 2 to go. Next up, PaCO₂ is at 50. Now, ding, ding, ding. Remember, this is our tricky one. It's the respiratory value with the opposite rule. The normal range is 35 to 45. So where does a value of 50 land? Perfect. This is that opposite rule in action. Because it's respiratory, a high value of 50 actually means it's an acid. So PaCO₂ joins pH in the acid column. And look at that, we're already seeing a pattern emerge. All right, last move. Our HCO₃, the metabolic value, is 30. The normal range for that is 22 to 26. So where does our final piece of the puzzle go? You nailed it. Since 30 is higher than 26, the HCO₃ goes right into the base column. And just like that, our game board is filled out. All the values are placed. Now for the easy part, reading the score. So we've played our hand. We've filled out the grid. Let's see how this simple board gives us a super clear and precise diagnosis. This is the moment it all clicks. And there it is, tic-tac-toe. We have a winner. Look at that acid column. The pH and the PaCO₂ are lined up together. That vertical line is our winning move, and it tells us exactly what the primary problem is. So let's break down what that win means. The pH is in the acid column, so we know the patient is in acidosis. Simple. And because the PaCO₂, the respiratory value, is in that same winning column, we know the cause. Put them together and you get respiratory acidosis. But we're not quite done yet. What about that lonely HCO₃ just hanging out over there in the base column? That's not a mistake. That's actually the body trying to fight back. It's the metabolic system saying, whoa, things are too acidic, and trying to help out. Because it's trying but hasn't fixed the pH yet, we call this partially compensated. The body is on the case. So let's put it all together. From that simple little game, we get our complete final answer: respiratory acidosis, partially compensated. No more guessing, no more confusion, just a clear, logical process that gets you the right answer every time. Okay, so we figured out partial compensation. But that gets you thinking, right? What would the board look like if the body was fully successful? I mean, if the body's compensation completely fixed the initial problem, where would you expect that pH to be? That's the key to spotting full compensation, and it's the next level of mastering this game.